Hello, my name is Ian McCall, and this is another in the series of videos for dermatology for dentists and dental students. We're going to look tonight at general medical conditions causing oral problems. Now, this can be done in great detail, but this is primarily for dental students. I think if you're asked a question like this in an exam, I think the conditions they're really going to be talking about are these ones down here: diabetes, cardiac disease, chronic lung disease, asthma. And they're really wanting to know what oral problems do they cause. Now, diabetes, it first of all predisposes you to periodontal disease, but then you've got the problem with the periodontal disease itself having a feedback on the diabetes and actually making the diabetes worse. And a similar thing happens with cardiac failure as well. The oral problems that result have a feedback effect, increasing your likelihood of developing a variety of cardiac disease, myocardial infarction. So think of these both ways. Think of the effects they cause in the mouth, the periodontal disease, and then think of the effects the periodontal disease causes on the conditions. In diabetes, of course, you've got high blood sugar levels that aren't more controlled, and that predisposes you to candida, predisposes you to other infection, and to periodontal disease. Cardiac failure has a degree of hypoxia associated with it. It means you don't have enough oxygen in your blood, and that predisposes you to periodontal disease as well, and poor healing in the inside of the mouth. Remember also, cardiac disease has other implications in dentistry, particularly if it's cardiac valvular disease, valvular heart disease, because patients will be on anticoagulants, and there's the problems then of doing dental work in patients who are on anticoagulants, and patients may have heart valve problems, or may have had infective endocarditis before, where they've had little infective concretions on the surface of a valve, perhaps damaging a valve, and have required antibiotic therapy. These are the sort of patients that may require prophylactic antibiotic therapy if you're going to be doing any dental extraction work, or work that's involving stripping away part of the mucosal surface of the mouth, or doing periodontal work. So there's problems there with these cardiac patients. Chronic lung disease patients, again, they've got hypoxia, but a lot of these patients have asthma, chronic obstructive airways disease, and they may be on steroids, especially the steroid inhalers. Now, the steroid inhalers are certainly going to predispose you to candida, and they predispose you to infection in the inside of the mouth as well, because people don't inhale them properly. Instead of breathing them straight down into their lungs, they sort of puff it into the inside of their mouth and really absorb it from there. Read up about these conditions. There's more than this. In fact, there was a little article here on diabetes from the Oral Health Database at Marmot. Worth having a look at here. There's a variety of sections. A section here on diabetes and periodontal diseases that is useful. Tells you about the different types of diabetes, and it goes on to talk about this association between diabetes and periodontal disease. Twofold increased risk of developing periodontitis for diabetics, but then it goes on to comment here that the association between periodontal disease and diabetes itself, that the periodontal disease influences the control of the diabetes. So it's very important that diabetics get their teeth looked after and don't get a lot of gum disease. Read that up anyway. What else? Let's look back at some of the problems in the mouth that you'll get from drugs. We've talked about erythema multiforme from drugs, or the herpes virus. We've talked about lichenoid drug reactions and aphthous ulcers. Patients who are, say, deficient of iron, B12 or folate, they'll get aphthous ulcers and problems with that. Then there's the oral side effects of drugs used to treat medical conditions. Now, we've talked before about the drying effects of certain drugs. Some antihypertensive drugs have a drying of the mouth effect. So do beta blockers. They're used for rhythm problems and heart disease. Antiepileptic drugs cause gum hypertrophy. And then you've got the problems with erosions and mouth ulcers from cytotoxic drugs. We said there that any disease reducing saliva, for example, Sjogren's, you really need to know about Sjogren's because of the severe dental problems that occur because of the dry mouth. Sjogren's is an autoimmune disease where a variety of exocrine glands have the secretions reduced, so you get dry eyes, dry mouth. They can get pancreatic problems. They can get stomach problems as well, problems swallowing. And this will cause both caries and periodontal problems. General medical conditions. Well, I suppose viral exanthems aren't general medical conditions, but we've spoken before about all the oral features that can occur with hand, foot and mouth disease, the Koplik spots of measles, etc. And then you can get venereal diseases that will have oral presentations, particularly the chancre, the ulcer, the painless indurated ulcer that you get in syphilis. So remember, you may look at this and think, is that an SCC? But it's not going to be painful. You may look at it and think, is that a giant Sutton's ulcer? But it's not going to be painful either, because the chancre in syphilis, primary syphilis, is painless. And there'll be local lymph gland enlargement as well. Let's have a look at some of these pictures that we've got here. There's multiple aphthous ulcers, and you'll see that in Behçet's syndrome. You might get 2 or 3, sometimes up to 5 aphthous ulcers. When you get a whole pack of them like this, then you have to consider Behçet's. And you can also get the smaller herpetiform ulcers, aphthous ulcer variant in Behçet's syndrome as well. Remember, it's a syndrome. Behçet's has involvement of the mouth like this, has involvement of the eyes, involvement of the joints, involvement of the genitals with ulcers there as well. And there's some skin manifestations too. We'll go back a bit. They show a condition called pathergy. Now, if I can just find that one I wanted to show you again. Let me come back to here. Here we go. Pathergy is where, if you're having a blood test done and you make a little injury in the skin, taking the blood sample, then a little pustule will appear at that site of injury. So that's the phenomenon of pathergy, and you see it also in Behçet's. This is someone with severe graft versus host disease. And now GVH will occur sometimes when the person's immune system reacts against the graft that they're having, that they've had, the transplant that they've had, and it sometimes will affect the inside of the mouth and the like as well. The pathology that you get is very similar to lichen planus, but a severe erosive lichen planus with oral ulceration like this. Areas of leukoplakia there as well. Here's another condition you might see around the outside of the mouth when a patient comes to see you. And this is a condition called perioral rosacea. And what you see is some sparing, a few millimeters of sparing around the vermilion border of the lip here. Areas of erythema, some little bit of scaling, and little pustules, tiny little pustules like this. And this is usually because they've been using strong topical steroid like Elicon or Elufrat, betamethasone. You use that in the face and you can induce this phenomenon. There's overgrowth of a little mite called Demodex in these little pustules. And of course, if they stop the steroid, it flares up badly. But they need to stop it in the long term before this is going to settle down. Here you've got one of the changes of lupus on the inside of the mouth, a systemic disorder with ulceration, quite marked involvement, ulceration in the lips here as well. And so you can see that it looks like erythema multiforme. Histologically, there's the same sort of basal layer attack by lymphocytes that you see in erythema multiforme. You see it also in systemic lupus. Here's someone with very glazed tongue. Look at the loss of the papillae here. It's a bit swollen, it's a bit tender. They get a glossitis, and that's due to iron deficiency. You'll get a tongue that looks like that. We talked of venereal diseases before. This is the ulcer, the chancre of syphilis, with someone who's had oral sex, and the primary lesion can be in the inside of can be on the surface of the tongue like this. It's often, in fact, on the surface of the lip where they have the indurated ulcer. And that's an example of, you might look at that and think, is that an SCC? But then they'll tell you this has come on suddenly. It's too big an ulcer for herpes unless it's an immunosuppressed patient. But if that's painless and indurated, and if they've got some glands in the submental or cervical area, then you've got to consider syphilis. And you want to have gloved hands on before you put your hand anywhere near an ulcerated lesion like that on a lip. Yeah, I think those were most of the things that I wanted to show you in this particular section. So let's go back again. If you get a question on the oral problems caused by general medical conditions, then really concentrate on diabetes, cardiac failure, chronic lung disease and asthma, a bit about anemia as well. Concentrate on those because of the devastating effect they can have with periodontal disease and that back effect, the feedback effect that the periodontal disease has on the underlying conditions. So make sure you mention those first, and then you can throw in some of these other things about syphilis, about the effects of the drugs that are used in treating these general medical conditions, and then these specific conditions, erythema multiforme, lichenoid drug and aphthous ulcers, that can be associated with some of these other deficiency problems. Thank you very much.